Weighing the risks, a tertiary centre audit of adherence to thromboprophylaxis prescribing guidelines in obese surgical patients. Obesity is a recognised independent risk factor for VTE and is associated with increased mortality from thrombotic events such as pulmonary embolism, ischemic stroke, and myocardial infarction. The AAGBI published guidelines in 2015 on the perioperative management of obese surgical patients and recommended tailored VTE prophylaxis in this group. This audit aimed to evaluate adherence to these guidelines in University Hospital Galway and identify areas for improvement. All adult inpatients who underwent major surgery over a 4-day period in July 2025 in UHG were evaluated on post-op day 1. A 100% adherence rate to the 3 following standards from the AAGBI's guideline was set. 1. VTE prophylaxis should be administered to all patients with obesity undergoing major surgery unless contraindicated. 2. Pharmacological prophylaxis should be weight adjusted. And 3. Mechanical thromboprophylaxis, example TED stockings, should be prescribed where appropriate. The dataset comprised of 40 patients, 8 of whom met the AAGBI's criteria for obesity. The results of our audit showed that mechanical thromboprophylaxis was appropriately used in 88% of patients with obesity. Pharmacological prophylaxis was prescribed in 75% of cases, but no dose adjustment was made for many patients weighing over 100 kilos. Post-operative thromboprophylaxis plans were clearly documented in the post-op notes in 75% of cases. To conclude, the audit demonstrated suboptimal compliance with the guidelines for perioperative thromboprophylaxis prescribing in obese patients. The absence of weight-adjusted pharmacological dosing in particular represents a critical gap in patient safety. Audit findings were circulated to the anaesthetic department and discussions with the pharmacy team have been initiated to consider initiatives to promote prescription of weight-based thromboprophylaxis dosing where appropriate. A re-audit is planned in 6 weeks to evaluate progress in guideline compliance.